I feel like our original mission was to make sick people better, and now we are looking at things with a different mindset. What can we do to keep you well?
Some people believe that once they've been diagnosed with a condition, that they're just going to have to live with that condition, and there's not much they can do about it except for go to the doctor and be prescribed more medicine. What this is doing is hopefully leading them to a healthier lifestyle where they aren't so dependent on medication, and that they can learn how to balance medication with healthy lifestyle choices.
Our big focus is preventative services at this point, because if we can treat things and get them under control before they are a problem, it is so much easier to promote overall wellness and to longer lives for people versus if we're trying to respond to a problem that's already there.
So transitional care and care coordination has really helped our patients and our community become healthier and more compliant in their chronic illnesses, and overall that has changed a lot of what we see on the clinical side for admissions and visits.
We've had several months now where we've had no readmissions to our ER. So it's been a drastic change, and I think mostly that is due to keeping in touch with the patient, giving them a resource that they can count on, and just letting them know that there's somebody here if they need them.
I think what the Delta program did was it brought me together with people I would have never worked with. Until we were brought together and identify those needs, we didn't know how we could work together. So I really think it just helped identify some of those common goals.
The center kind of pushed and prodded to think outside of the box of those normal people who you would normally see at the table. And so we have to reach across those lines. It has to be partners that aren't the traditional partners, because more people play a role in health than healthcare itself.
We have local banks, presidents and vice presidents on our committee. We have media people on our committee. I think you need all those personalities. I think in a small community, everyone has a different skill set and everybody has a different reach. And so I think it's important to pull all of those people together.
The more leaders that you have and the more joint partners you can bring to the table, the further your ideas can go and the more that you can help the community.
We have the same social and economic issues, housing, transportation issues among some of them. And if we work together, we can help create a county that can address all these better than one hospital trying to do it alone.
So I'm from this community, and it's important to me that my family and friends have the resources that they need, that they don't have to drive 30 minutes north or south to the nearest hospital. They have everything that they need right here, and they can be confident in the things that we have here.
Our community members of DuQuoin are definitely healthier because of the transitional care and the care coordination that we're providing at their hometown hospital. I feel like it is one of the best things that we can offer. It meets our mission and our vision and what we're working towards. We really just want a healthier population overall.
So the communications toolkit was very essential for me in just starting the whole process of Community Champion, because I needed help with that. I needed to know how to effectively reach out and get the response that I wanted. Honestly, Delta has taken me from, this kind of scared, introverted person into a world of having to be more extroverted and having to really put myself out there and make my voice heard. I feel like I have that insight, and I also have the tools, the communication tools, to help me along the way too.
Anybody that's in healthcare knows that it's ever changing, and there's always something new on the horizon that you need to change and adapt for. So the Delta program helped us grow financially to be more sustainable in those areas so that we can adapt in the future. The Delta program gives us a chance to kind of see those evaluations through, and then the implementation and the assessments on the back end. That fresh set of eyes for us has been invaluable.
The Delta team has been absolutely amazing throughout this whole process.
The Delta program has helped us evolve absolutely.
If other hospitals have the chance to take part in this, don't deny it. take advantage of that. It's so amazing, and there's such great help.
It just makes you appreciate what you can do in a small town like this, and you don't have to go to the city to get what you need. You can get it all right here.
Just knowing that we are helping people be healthier, I think that's the greatest feedback of all.